The ultrasound examination of the ankle begins with the study of the lateral compartment. We need to flex and turn the knee and the ankle in this manner in order to be able to scan the outer compartment. The first structures to be studied are represented by the ligamentous components, and in particular from the front components that are formed by the anterior talofibular ligament. This is a scan along the major axis of this ligament. It can be seen as the form of a structure stretched between the lower edge or apex of the lateral malleolus and the most lateral surface of the talus. This is a very thin ligament of 2 or 3 millimeters, and we must therefore be very careful to make small movements of the probe to view it properly. If we do the scan sliding upwards, we find another very important structure proximal to this ligament, that is the anterior tibiofibular ligament. This ligament naturally extends itself between the front side surface of the tibia and the fibula. We now study a third ligament, really well shown thanks to the ultrasound, called the calcaneofibular ligament. We have to make a dedicated scan, including a plan that starts from the apex of the lateral malleolus and goes on the back up to examine the oblique course of this ligament. It is easier to highlight it by putting it in tension, while inviting the patient to flex the ankle dorsally in this manner. In this way, it is possible to highlight it correctly, as we see it very well in these pictures. This movement compresses and displaces toward the superficial layers two of the major tendons of the lateral compartment, known as the peroneal tendons. These tendons are always studied in this position, mostly scanning from the back of the ankle joint. Here we recognize the surface of the fibula, the cuff, the superficial and deep peroneal tendons, which can be studied on both the short axis, thus devoting a more panoramic view to the insertion. The insertion here is very well shown, and it is the insertion of the short peroneus that, as you know, fits at the base of the fifth metatarsal bone. We now move to the anterior compartment of the ankle and study some of the most important tendinous components. We start with axial scans on the side to see the anterior tibial tendon. This tendon is the most voluminous of the anterior compartment, and it is well highlighted along the short axis as we see on the screen. And it can be studied by rotating the transducer clockwise by 90 degrees in its longitudinal extension. It has a characteristic appearance of a very superficial hyperechoic fibrillous structure. I would like to remind you that the tendons of the ankle have sheaths, but these sheaths can be visualized by ultrasound only if extended into the liquid. We return to the axial scans and we move medially to see the common extensor tendon of the big toe. This tendon is obviously thinner than the tibialis anterior, and it is laterally placed to the anterior tibialis. We then end the valuation study with the extensor digitorum tendon, which is even thinner than the other two, and, being the last tendon of the anterior compartment, is placed sideways. Even in this case, as for all these tendons, we do two scanning planes, one on the short axis and one on the major axis. Finally, an important structure to be looked at is the deepest part of the ankle at this level and is represented by the anterior surface of the tibial distal epiphysis and the most anterior part of the talus, rather the two anterior components that form the tibio-talar joint. This scan is very important because it allows the identification of the joint capsule and display a joint effusion where there is the presence of a fluid. We now consider the anatomical components of the ankle's medial compartment. and we start with axial scans to study the first tendinous component. We scan on the back of the ankle joint to display a first structure which rests directly on the tibial malleolus. This is the posterior tibial tendon. This tendon is very large, and it is the one following the malleolus in its morphology. It then moves up to the front at the level of the insertion in the medial surface of the tarsal navicular. We now go back and we display two more posterior structures which are represented by the flexor digitorum tendon and finally, contiguously to the flexor digitorum, the vascular nervous bundle with a characteristic aspect of the tibial nerve. We can also evaluate the extension of another tendon, which is the flexor hallucis longus. All these structures can be displayed on both axial planes, so on the short axis and on the long axis. Another important structure is the medial ligament component, which is represented, as you will know, by the deltoid ligament. The ultrasound allows the study of the three main components of this ligament, known as its three main beams. By doing scans from the apex of the posterior tibial malleolus, we are going to study the tibia-talar rear beam. If we scan in the middle, from the apex of the tibial malleolus, we can study the tibiocalcaneal bundle, and finally, the most anterior tibio-talar bundle. For the study of the posterior compartment of the ankle, we invite the patient to lie on his stomach, so we can easily scan all of the structures. The position of the foot is very important. Feet should be outside of the bed to be able to perform dynamic maneuvers. The most important structure that we analyze is obviously represented by the Achilles tendon, which, as you know, is the largest tendon in the human body. We display it very well using ultrasound, as you can see in this situation, along the long axis of the tendon. The Achilles tendon has a fibrillar characteristic aspect due to the interfaces that are created between the nutrient septa and the collagen fibers. It has a very evident structure and it can be studied by scanning long axis through its insertion at the calcaneal surface. We do the scan with the foot outside of the bed and we ask the patient to flex the ankle on both axes to perform a dynamic study. This way, you can examine the tendon during its own natural activity. Another important scan is the one along the minor axis of the tendon, from the proximal myotendinous junction, which is part of the gastrocnemius, to reach the tendinous structure. We have to focus in the scan to keep the orientation orthogonal, to avoid artifacts related to the anisotropy. I would still like to remember that at the level of this insertion there's a small purse, the retrocalcaneal purse, which obviously can be studied only when it is distended by fluid. Finally, we move to a study which is very important when evaluating the Achilles tendon. This is the study of the plantar fascia, which has an important role as this whole complex works as a functional achilloplantar arch. The main scan is performed in this manner. However, it is important to ask the patient to move upwards slightly in order to place the big toe on the bed. In this manner, we can tend the plantar fascia. This allows to avoid errors of judgment. The main scan is along the major axis at the level of its insertion. As you can see from the images, the normal appearance of the plantar fascia and its insertion at the calcaneus bone. This scan allows us to study very well this band on both the long axis and on the short axis in all of its length. With this last approach, the ultrasound examination of the ankle is complete.